one more minute. Why don't I just kick it off? And actually, I see we have a bunch of people online as well. And while one of our participants is putting her parking pass in, I'm just going to introduce myself, and then why don't we just sort of kick things off, and we'll just sort of work Lucene in. So I'm Michael Goldberg. I'm our executive director for the Veale Institute for Entrepreneurship here at Case Western Reserve. I'm also a faculty member at Weatherhead. And today's panel, which I'm super excited about, I do apologize for not being there in person. As I was chatting before, I'm at Duke, where our daughter just defended her honors thesis, so I'm here with her. But today's panel actually grew out of a number of discussions we had with friends on campus. Much of the work that we do in our entrepreneurship series is focused on high-tech growth startups oftentimes, and many of our students actually across industries, whether it's healthcare, dental medicine, psychiatry. I mean, there's all sorts of interesting technologies that many of our students get passionate about and look to solve a problem in the real world. Another way that many of our university graduates get into the world of entrepreneurship is through starting private practices. And this is particularly true with graduates from our School of Dental Medicine, our School of Medicine, our School of Applied Social Sciences, our School of Law. So today's panel, which brings together a number of friends from our community in Cleveland, is going to look at some of those trends. And I think it's interesting because I actually happen to know all the people on the panel quite well. And even though they're opening up private practices in different areas, I think there's going to be some interesting areas where there will be some joint, some things that are similar, maybe some things that are different. So I've asked, all of our panels are moderated by students. So Christopher George, who is a law student, second-year law student, actually worked in the private sector before coming to Case Western Reserve as a law student, is going to moderate today's panel. So with that, Christopher, let me turn it over to you to kick things off. And thanks everybody for joining on Zoom and on LinkedIn. And if you're joining, if you have questions, because Christopher's going to ask a bunch of questions, you can put your questions in the chat on Zoom, or raise your Zoom hand, or put them in the comments on LinkedIn. So with that, Christopher, I'll turn it over to you.
Thank you, Michael. Well, everyone, welcome. Those who are with us in person and virtually, welcome to the Case Western Reserve Entrepreneurship Speaker Series Roundtable Discussion. My name is Christopher George, and I'm a second-year law student and fellow entrepreneur here at Case. Today we'll be discussing insights into starting your private practice. I'm pleased to welcome our distinguished panelists to our campus. Starting here is Dr. Justin Mistovich. Here is Dr. Keili Mistovich. Here is Dr. Margaret Frankel. And here is Dr. Lucene. So before I get started, the format of this panel, I'll be conducting the moderation, and it will consist of roughly 30 or so minutes of questions that I've generated, but then we'll open it up to audience members virtually or in person who want to ask questions for Q&A. So with that, let's get started. So could each of the panelists briefly introduce themselves and give some insight into your practice areas? Starting with Justin.
Cool. Hi, everybody. I'm Justin Mistovich. I am a pediatric orthopedic surgeon. I'm on the faculty here at Case. I work at Rainbow Babies and Children's in Metro Health. And I also know Michael two ways. I know Michael from the tennis court, where he roundly beats up on me. And then also from Weatherhead, where he did the same during my MBA. So Keili and I, we happen to be married. And in addition to my work, which is very, I would say very regimented and sort of closed box thinking at the university in you know, an academic, very straight way. We're also sort of interested in how we can disrupt and innovate within a healthcare milieu, and particularly bring like an entrepreneurship trend to primary care, specifically in pediatrics. So I'm a pediatric orthopedic surgeon, Keili's a pediatrician, and we founded this company called Just Pediatric Network, which then provides sort of a framework and a medical services organization model for patients to have a pediatrician, and for pediatricians to then have a patient panel where they can go and practice and be a doctor the way they want. And they can do it without having to understand and manage the business end of things. So they can run their practice, but they don't have to worry about the back end supply. So we've partnered with somebody who was a former UH vice president and started this company. And now we have offices in Pennsylvania and Ohio. We're about to add another office in Florida. So it's been fun.
Sure. So as Justin said, I am a pediatrician. I started my journey in medicine after coming into Cleveland when Justin was recruited here and was working in a private practice, like a large independent practice, and ultimately just couldn't deal with the structure of that and sort of being limited in what I can do and how my time is being spent and trying to race through patients every single day. And so I, about 5 years ago, decided to open what's called a direct primary care style of office. It's sort of concierge-like, but in a little bit of a different way. I have a much smaller patient panel. I can spend all the time in the world with my families. They know me well. I know them exceptionally well. I know the names of their kids' stuffed animals, the whole thing. And so and then they have direct access to me where they can call me and text me, and it's constant communication. And so it has freed me from sort of the what we call the moral entry of medicine, where you just can't do the job that you want to do. And so so when I left that practice, I opened up my new office, and that was sort of the beginnings of the Zest network. And we said, you know what, this is too good to keep to ourselves. We need to bring this to more doctors so they can practice like we are, and also, to families.
Dr. Margaret Frankel. I am a private practice dentist practicing comprehensive general dentistry in Cleveland, and I'm a graduate of Case Dental School in 2013. I am married to another Case graduate from the medical school who also did residency at university hospitals and practices there, Dr. Jonathan Frankel, who is an ENT facial plastic surgeon, and he has opened a plastic surgery private practice in tandem next to mine. So we're both entrepreneurs and exist outside of the traditional medical model. Much like Keili and Justin just mentioned, we are, especially in my practice, trying to innovate and push dentistry forward outside of the constraints of maybe what you would encounter in an insurance style practice, dental practice, a traditional maybe dental model. And so we're integrating overall health, airway health, well-being into my dental practice.
Thank you.
So I'm Dr. Lucene Wisniewski. I'm a clinical psychologist, so I'm sort of the other end of the doctor spectrum over here. I run something called the Center for Evidence-Based Treatment, but this is my second business. My first business was something called the Cleveland Center for Eating Disorders. So although I'm trained as an academic and I'm actually adjunct faculty also here at Case, because of the similar limitations that we were finding in working within a hospital or tertiary care facility where there's large oversight in terms of how things got done, I had left that environment probably the first time back in 2006 and started the Cleveland Center for Eating Disorders, which I built and then sold to a larger organization. And I worked for that organization for a short period of time and then started this one. And so this is the Center for Evidence-Based Treatment. So this is my second venture. And really our goal is to provide, it's interesting to listen to you guys talk, which is maybe perhaps the difference between how medicine works and how psychology works, because the way that I think about my practice is we run a practice that is more modeled off of an academic treatment center, but we run it in a private practice because in psychology, it is more often the case that in direct care, the care is much more general and broad and not as unique to each person as it is that happens in academia, where it's like, this is the treatment that you get, you're working on a randomized controlled trial, you get this treatment and we know it has this outcome, and that's not how most therapists run their practices. And so we run what I would consider as a more academically oriented practice in a private practice. So,
right. Yeah. Thank you for the introductions. So my next question is segue off my first question, is after graduating from medical school, dental school, or a PhD program, how do you know the timing was right to start your own practice? Would you recommend maybe getting some experience first or getting right into it? I'll start off with that, Justin.
This is a great question. I would probably defer my answer to Keili, but I can give my perspective on it because technically with my day job hat, I'm still in an academic group setting. But I think like watching her practice evolve, Keili was on the faculty at Pitt for 1 year after she graduated, and then took private practice, group job, and then ultimately ventured out. So I think there's pros and cons to doing it one way or another. I do believe, if I put on my my co-founder hat for Zest, that when we are looking to hire a pediatrician in this model where you're taking care of a small number of patients in a high-touch sort of way, that we want people who have had some degree of experience in a high-volume setting and are comfortable putting patients at ease and giving the level of care that we want. And I think similar to a residency or a fellowship to follow a residency, I would look at the first few years of practice as sort of like a fellowship experience for which you have more autonomy and you're getting paid hopefully better than a fellowship would. And I think once you have that level of experience, then you can know what you want to focus on and how you want to practice. So there's no one size fits all, and it really depends on the type of practice you're trying to form. But I don't think that it's a bad idea to get some experience in the real world so you can know what those limitations are before you launch.
Yes, I would definitely agree with that. And I think in our model where most of our doctors are practicing independently in an office, they are, one of the downsides is they don't have colleagues surrounding them to be able to ask questions of. And so if you're doing that, you need to already have the confidence level where you don't really need them on a day-to-day basis. Certainly when complicated cases come up, we have created a community where we can reach out and ask each other, but you don't have somebody there all of the time, which when you are for, your first year, 2, 3, 4, after you leave your residency, you 10, even though your residency is very intense, there's still something that's different when you actually graduate and start for real. And you are the end, you are the responsible one. So having a little experience is really helpful.
If I could add to that, one other thing I would say that probably Dr. Frankel and the other Dr. Frankel's answers are different than ours, and I think that that's very good. I think that there are nuances between the specialty that you pick. I certainly think anybody can go out and open a pediatric general office in any area, but in a region like Cleveland where it is a little bit more saturated and you're trying to provide sort of like a premium service, that having some degree of expertise behind you may help for that. And then also, like, if any of the audience are in a position where they are thinking about a professional career that they want, there are certain things that will limit those choices. So, for me as a pediatric orthopedic surgeon to go out into the community and be like, I'm going to just open up a private practice pediatric spine business, like where are you going to operate at, right? Like, so these things I think are sort of downstream sequela of those decisions you make on how entrepreneurial you want to be and what those choices are as a function of the practice.
Absolutely. So Justin, thank you for the segue. I think one of the things you're thinking about are allowing me to touch on is the fact that within dentistry, a private practice model is more common, right? Traditionally, dentistry was like a sole provider who put up a sign and developed a dental practice. So the infrastructure is there. Dentistry has changed a lot over the last decade or so, with private equity flowing into the field and creating large, more corporate style practices. So it is not as common to have a private practice, but the infrastructure, like I said, exists. Same as in facial plastic surgery, right? Facial plastic surgeons commonly have private practices. So it felt more natural to be able to do that, right? For me, I think I knew that I wanted a private practice. It seemed very attainable. I was lucky. My father is a dentist. I moved into his practice and I had a vision different from his, and I used what I was given to create. This was a platform for me to create a different style of dental practice. So, thank you.
I think, psychology must be so different because it is not dissimilar in that there are lots of people who finish their degree, and I'd say this about master's level counselors as well as PhD. You finish your degree and then you can start a private practice. Now, I don't know that I would call that entrepreneurship, because that's kind of you're just managing yourself and you're sort of running a business. I guess it is, but I don't think about it in the same way. And to answer your question about when to do it, I think there also has to be a decision about what you want and what you want your impact to be. So there are lots of people who sit in their office and see 40 patients a week and don't have colleagues and I'm sure give good care. But I think that if you want to, if you're thinking about being an entrepreneur and perhaps broadening your scope, it's just a different vision. And I know for myself, I didn't have that vision. I sort of backed into it. I was working at a hospital where the hospital was bought by an evil entity that made my ability to run the practice that I was running for the hospital impossible in the way that the cutbacks that they made. And I knew that it was important to me that the quality of care be a certain way. And so I needed to do it on my own. And so I never set out to be an entrepreneur. And I think we were talking in the elevator. There was not 1 minute of graduate school where anybody taught me anything about business. So I think the other piece is then how do you learn about how to do these things? That's what I mean by if your goal is to run your own little private practice and see patients, I don't think you need a lot of business acumen to do that. You see patients, you collect money or you don't collect money, and you figure that out. But if you're gonna expand as a therapist anyway, if you're gonna expand what you do and have other people, the amount of knowledge and training that you need. I was lucky enough in my first business to have a colleague, my co-owner. His father was a businessman, and so I learned a lot by osmosis. But I didn't go to business school. I sort of had to learn on the way. And so I think your question about does it make sense for people to get experience now? Absolutely, because you don't. And also, sort of apropos to what Keili said, as a new graduate, you don't even know what you don't know yet. And so you don't know where things are going to take you. So being able to get experience, have these conversations, and be thinking about setting yourself up for the possibility in the long term makes total sense. So it's so great that you guys are having these conversations now.
Great. Thank you for the insightful answer. So one of the main things, once you decide the timing is right, you make that leap into found a practice or to acquire a practice in your case. Do you have a formal roadmap in place? And for those of you that didn't have the business experience, how did you teach yourself that? How did you navigate the business landscape that's challenging even for experienced businessmen?
So I think for Keili's practice, when she opened up her first office, sort of like the test model for the big network that is now turned into existence. This was sort of around the same time that I was finishing up my MBA or in the thick of it, or just done somewhere near there. So, we started off with just a simple business model canvas, and we're like, okay, here's the services that we're going to provide. Here's how we're going to generate revenue. Here's some other side avenues of revenue. Here's an estimation of what this will be, and then how are we going to find patients? How many are going to come from the existing office? How many do we need to do? How much should we spend on marketing? Does this make sense? Is it financially viable versus what the real estate costs and some of the other legal costs that we could estimate would be? And then, off we went, just sort of refine that as we went through. And then for Zest, we are part of EO, and we run, the book Traction is fantastic to read. It's not a page turner, but it's a great manual for running a company, and we run EOS, the Entrepreneur Operating System. And this is a very structured way to run a company. So, we set, a 10-year target of where we want to be, and then look back, and then eventually it gets broken up into 90-day rocks of what you should be working on, who's responsible for it, and smart, specific, measurable, actionable goals for, and who's accountable for it for each quarter. We have meetings like that. So when we started this venture, we started off with a big retreat of is this a possible thing? We socialized this with a group of friends and mentors and colleagues and critics pretty widely, and had everybody poke holes in it, and then put together a strategic plan, and then self-funded it, spent a scary amount of money, and here we are.
What's EO?
The Entrepreneurs Organization.
I don't think I have too much to add to that. that is what happened.
Yeah, a roadmap. So in school, there's like one business course that they give you in dental school, right? There's so much to learn in 4 years, and residency is not required in dental school. So you get this like tiny entree into a dental business, which is like a joke. You look at an accounts receivable spreadsheet, and that's about all I remember. So there is no roadmap. So I think one of the best parts of the way I've proceeded in developing a dental practice, right? I knew I wanted to do that. I was brave in the fact that I came up with a vision and I started the practice. But what's guided me in the way it's developed is really the vision I have had for the practice, which may be outside of what people who are strictly trained in business would do. Like my business model has not been specific. I'm not driven by numbers. I'm driven by the way I want to care for patients and the way I want to drive dentistry forward. Luckily, it's been successful, but that's not what's driven the growth and the development of the practice. It's really been patient-centered, using a lot of literature, right, and integrating modern dentistry into the practice to allow it to grow.
I'd say my experience is somewhat similar in that it has, at least in this business, I've never had a business plan. It's been very organic. I started with myself when I first left the other organization, and then added people along as the vision, as I got saturated, and then the vision needed more individuals to be able to continue to move it forward. So I'd say, and I'm also pretty risk averse. Like I've never taken out a loan. I've never had a red month. But I just build from the center out with excellence in mind. And at least for me, it seems to have worked out. I'm not sure if it's a replicable model, but it seems to work for me.
Great. Thank you. So whether you're acquiring a business or starting a business, there are inherent challenges that are present. How did you navigate those challenges? And is there anything now looking back you would have done differently when you first started the business?
I think, anytime that you're running a business or starting a company, there's always going to be like these logistical challenges. There's a Haitian proverb that says, beyond mountains, there are mountains. And I think that you just need to have this equanimity about it, that there's always going to be the next thing that comes. And as you work through a cycle, whether it's a calendar year or like from an onboarding of a patient to like a launch in the world of a kid, maybe hopefully not like the same kid with an 18-year plan before you learn everything. But as you see these things happen, you sort of get a sense of how this should all function. So I just think that's business. I don't think that there's any big lessons learned from that other than like developing a framework of how you can see this and learn from it and not sort of repeat the same lessons learned, maybe not as easy as they could be. I do think the thing that we've learned the most, or that maybe we would change, is that the culture really matters, and like you have to set a set of core values of who fits in that and who doesn't. And this can be everyone from like a partner that you're hiring to a somebody who's like cleaning your office afterwards. So the core values and everybody being a part of that really matters a lot. And we said no initially to some people that were hard to say no to, because if you're starting an entity and it's just sort of an idea and it's in the pre-revenue phase, even like saying no to people for your idea, it's pretty ballsy. It was scary, and maybe stupid. It felt at the time, but when I look back to those people that we've said no to and the culture that we've been able to grow because of the people that ultimately we said yes to, I don't think it would have been the same if we had compromised on that stuff early on. And similar along those lines, there's some people that we should have said no to sooner or dissociated with sooner. And for one reason or another, whether it's convenience or fear or clinical balance and practicing in the same way but not aligned business-wise, those relationships maybe went on for longer than they should have to the detriment of the company. So I would trust your instincts and clearly figure out what your core values are, hire and fire along with those, and then run your company along with those. I think it's the biggest lesson learned.
Thank you.
Yes, I would echo that in many ways. I do think that the culture that you build within your corporation or your company makes such a difference in moving forward. And I think I'm very proud now of who it is that we have as part of our team. And it's been very intentional, and we have really spent a lot of energy sort of cultivating what that looks like. And so I would put a huge emphasis there. And then second, I think the other part of it is we have learned how to not get distracted. I think it is very easy when you are early on and you're in the building of a practice or a business to sort of see all the shiny things and want all of them at the same time and sort of try to figure out how you can incorporate that. And you can often lose sight of where you're actually going. And so we have been really putting some effort into sort of refining what does that look like and making sure that we are really staying true to sort of our core values and our mission and what we're actually about, and not getting distracted by things that we could along the way.
Thank you.
Yeah, so challenges. I think one of the biggest challenges I have faced is the human aspect of all of this. Is I am a mother, and I am a wife with to a husband who also has a private practice, and I think the biggest challenges are managing a private practice that takes a lot of time and energy, right? Especially if we're all passionate about what we're doing. That's why we're, consider ourselves entrepreneurs and pushing our field forward. The challenges are the balance of time and energy and where it belongs. And in terms of the business, specifically, at the end of the day, like, it's a small business and my name is on the door, and it's a 24/7 kind of a practice, right? So, the staffing that you're managing and the patients, there's a lot on your plate. And so I think like acknowledging that I could go back to my former self, right? Or not my former self, excuse me, my younger self. I'm not reincarnated, but my younger self, I think I would have said to my younger self, like, hey, there are seasons in life. Like, you're going to have kids and you're going to balance that with your practice, and just acknowledge like growth, like staying true to your vision and growing, right? Like strategically and not wanting it all at once is like really important. So just like seeing the bigger picture and how your business, that whole aspect of who you are, that doesn't have to be like a now. Like it can grow slowly as you're growing in your life.
I'm so glad I sat here because I get to go last, and so I get.
I'm glad you sat there too. You're the most insightful person here. Every time you talk, I'm like, oh boy.
But because I listen to you guys, and I feel like my experience is an amalgam of all of these pictures, right? Like I would say, all right, one of the key issues for me, I kind of don't like the word regret. I don't like to, because I feel like I make pretty wise-minded decisions as I go. Now, hopefully, as you said, you learn as you grow. And one of the things that I feel like I've learned over time with business is the patients aren't the problem, it's your staff. And so having the culture that you want to have is key. Hire slowly, fire quickly. I have tried to remind myself, as hard as that is, because you care about the people, you don't pick them at random, you pick people to work with, and then when you find out it's no longer a good fit, figuring out how to exit that relationship without compromising patient care and without making the rest of your staff hemorrhage is a skill that needs to be developed over time. And then equally so, sort of, one of the things that I think about when I talk to people that I'm going to hire is we expect that your family is number one. I expect that. That being said, your job is right here. We're not saying that your family is here and your job is here, or the other way doesn't work for the way that we try to run our business, but you need to have a pretty good, close relationship between your family and because we work with, my practice works with people who are pretty compromised and pretty difficult, and it's not a just show up and put your feet up kind of job. So I think all of those things are I think, I don't know that gets back to Keili's point earlier about having experience. I don't know that I could have known that when I was starting out, just because it was all relatively new. So, and then but to your question about how do you learn, because I think that's the other thing is you need mentors and you need to talk to people, because if you're just doing it on your own, you're going to make mistakes, and you'll figure it out because you're hopefully smart and insightful, but it'll take a lot longer than if you're talking to people who've done this before and there were years that I had I hired a consultant because I didn't know what I was doing. And I would bring problems to that person and almost like a therapist, ironically. But so like getting consultation is part of how you figure it out, I think, if you're not lucky enough to have an MBA or smart enough.
Sorry. I think Margaret said something that's really important for our listeners, and she talked about the balance, how that can evolve over time. So it's really important not to discount that in any way. I think that there is a culture that happens in America, in professional careers, especially. I'm sure you've seen this in law,
Sure.
where there is this like underlying guilt that happens if you're not working as hard as you can or working all the time. And like Lucene said, you just have to figure out what your balance and priorities are. And I'm a sailor, so I look at balance as sort of like a sailboat in balance. It's never always in balance. Like there's never a point where like, sweet, I'm in balance. Like I'm gonna just go crack open a beer. Like it is, I am in balance for this second. I'm constantly monitoring and changing other things, and there's so many variables that are influencing the boat. And if I'm not trimming and adjusting and measuring constantly, I'm going to get out of balance pretty quickly. So balance is a state that you strive towards, but it's never a state in which you are permanently in. So I think if you accept that and know that some of these influences and variables will evolve over the course of your career and over the course of raising kids, this is okay.
I like the sailing analogy. I'm a sailor too, so the wind, it's constantly going to change in different directions, but sometimes you have to tack or adjust the sails for sure, go on a new course. So, anyone else have anything to add on that about balance? Or if not, I'll move on to the next question. So, what makes your practice model unique or different from traditional practices in the field? I'm going to start down here.
I'm ready for it. And I think I said this when you did the introduction. In your classic therapy environment, someone calls up and they say, I've got a problem, and they say, okay, this therapist has an opening on Thursday at 5. Does that work for you? No, I can't do that. Okay, how about this therapist? They have an opening at this time. And that's how it is standardly done. Like someone has an opening, and so that's who you see. I don't feel like that is a good way to make sure that the person is getting their needs met. That's one need. When the person is available is important. But what perhaps is more important is, does that therapist actually have the skill set to help you with the problem that you have? And the other thing that happens not infrequently, because when you're living with a problem, you're not always clear-minded about what the problem is. People call us and they say, I'm depressed. And then when you meet them, you find out not only do they have depression, but they have an eating disorder, they have an anxiety disorder. And so that greatly influences the treatment we're going to offer them. And not all treatments are created equal, and not all therapists have the skill set to manage the problems that certain people come in with. So the way that we run our practice, again, this gets back to the notion of academia. We very much we do a pretty full evaluation to get a sense about not just what you think the problem is, but what else might be going on that's influencing the problem. And then we make a match between what your problems are and then the therapist who does or does not have that skill set. And if we don't have someone that has that skill set, we'll prefer you rather than have you see somebody who is going to give you weak tea. And so as far as I'm concerned, it's a pretty unique way that psychological services are offered, and is not in general the way that people are able to get services. So that's what makes my practice unique.
So I'm the owner of Richard's Frankel Dentistry. That's the name of the dental practice. And the slogan, if you will, is dentistry designed for health and well-being. So in my practice, what we have done is really tried to integrate overall health and well-being into the way we practice dentistry. I think traditionally dentistry is seen as outside of medicine, but really the mouth, and this is one of our focuses, is like it's a key organ, right? It is our airway, right? So the top and bottom jaws are what comprise our airway. It's how we breathe, how we eat, it impacts how we sleep and how we communicate. It is the start of our gut, right? So the oral microbiome is intimately linked to our overall health. And for example, the bacterium that we find in the mouth, we can find in other places and link it to Alzheimer's disease, cardiovascular disease complications with just inflammation. And so I've integrated a lot of, current, medical and dental literature into the practice, trying to be very evidence-based and current. And so it's a marriage of medicine and dentistry. We try to see the whole person like you do, right? It's not just about one problem. It's about integrating their health history into the way we practice. And the other aspect to it is that we really want to gain and have a very special relationship with our patients, right? So it's not like a quick, drill and fill kind of practice, and we integrate aesthetics and cosmetics into the practice because generally if things are breaking down or don't look right, they're probably not healthy. So it goes beyond just saying like, oh, I want a pretty tooth. Well, what is that tooth that is not right? What does that actually mean? So it's more integrative in its style of practice.
Thank you.
So, direct primary care is a very different model of practicing medicine in general. I think it's really focused on the relationship between a doctor, her patient, and the family. And, in traditional medicine, we've gotten to the point now because of all the constraints of insurance companies that you can see people for 10 minutes and you expect to learn everything that there is to learn about a kid's life over a year in 10 minutes, and you're gonna, be able to counsel them and do all the things, and it is impossible. And so we have completely thrown that to the wind and do not take any insurance. And so that allows us and frees us up to be able to practice in the right way, we believe, and in a way that provides us the time to spend with our families, that I can sit and talk to, family for an hour or 2 hours if I need to, and just really get everything that I need to know about them to actually take care of them in the way that they need to take care of. And so that also, because of the fact that our families have they have my phone number, they can call me and they can text me whenever they need anything. It really changes the dynamic of their anxiety of raising their kids and being able to talk to somebody and sort of having your doctor on speed dial and knowing that you do, and you know who you're going to get on the other end of that phone. It makes a huge difference in your confidence and just your ability to feel like you're being a good parent. And so, so the goal is essentially to change. What does that feel like? What does it feel like to have a pediatrician as part of your team and really as part of your family? And then we also, within the Zest network, we have sort of expanded that such that, while I know a lot about kids, I don't know everything. I'm not an expert in all things kid. And so we have sort of begun this process of bringing other professionals into the use. So we have a psychologist, we have a dietitian, we have a sleep consultant, we have a parenting coach. So we sort of have expanded, and all of those people are able to participate in care, and families can reach out and have access to that extended network of people. So
Thank you.
So I think Keili did a fantastic job of touching on how the practice works in terms of the doctor-patient, and we call them ZAPs, the Zest Associated Professional Services, the other healthcare professionals who are part of the team. But the big thing that, from a business standpoint, to add to that is that we don't take any insurance at all. So our practice is a subscription-based model, and patients have a mean of about $120 a month that they pay for their services. And if you break this down, that's about the cost of a cup of Starbucks a day. It's cheaper than your cell phone bill for most people. And for that, we have been able to change really the paradigm by which pediatricians practice care. And in Keili's old practice, she took care of 3,000 patients. That was her personal panel. And when she was on call for the group, she covered 12,000 patients.
Took care of his Lucene.
Took care of it. Attempting to hurt. So it's really, it changes these interactions in quite a significant way. And I think that there's a concept, there's a guy who's done some work for us, Jonah Goldberg. He's a professor at Penn, Jonah Berger, yeah, Michael Goldberg, Jonah Berger. So Jonah says that if you're going to sell people on a premium product, you need to let them see what it's like inside of the VIP section of the tent. And once they see that, they won't be able to imagine having medicine another way. So you really want to lean into the pain points of a conventional model, like not being able to see your own doctor for sick visits and things like that. And then that can help the practice grow. So we try to lean into those things. I think, so one thing that I can add and hope maybe a value to the group if I put on my own professional doctor hat is that you don't have to be an entrepreneur to be successful and think in an entrepreneurial way. There's a concept that's important, I think, to think about too, called an intrapreneur. And that's somebody who has an entrepreneurial mindset that functions in a conventional model and is there to lead and build and grow things that can make a difference. So in my day job hat, I'm the division director of Peds Ortho at Metro. And I think our mission there is to provide world-class musculoskeletal care to everyday regular Cleveland families and to help them have a fair shot at becoming the best version of themselves from a health and athlete, getting a scholarship and all that sort of downstream sequela of having good bone and joint health down the line. So similar to running a company like we do after hours for me or full time for Keili and Drew. When I'm at work there, we run EOS there, and we set rocks, and we build, and we grow, and we do marketing campaigns, and all those other sort of things that you can do to help a practice run better. So you can start out in that, and that can be your only source, and that can sort of scratch that itch if you do it well intentionally. And if you want to then graduate to running your own business, you can certainly do that too.
We got a question online.
Great, yeah, I was about to open it up to the virtual questions, so.
Cool. So we have someone online who asks, have you ever experienced burnout or encountered issues with maintaining a work-life balance? And if so, how did you combat that?
Never. I mean, I think that you said it, like, when you run your own business, it never stops. Like, you can't we just went on my husband's a physician who works for another organization, and he was able to take time off from his job because there were people who were doing his job when he wasn't there. I don't have that. So we're in Australia, and I'm still running a business from another continent, trying to figure out how to make sure my staff is okay, this problem happened. You do need to really pay attention to your own burnout and abilities, because it is rare that you can turn it completely off. Because, like you said, your name is the name that's on the front door also. So, it's not just the logistics, but it's also the reputation. So I think it's a constant effort.
Absolutely. I think also, like, talking to my younger self, I would say, like, and for those that are about to embark on this journey, like, you have to put pieces in place to protect yourself from burnout and from waking up one day and recognizing that your kids are growing up in front of you and you've spent tons of energy and time investing in what I would consider another child, a baby. Is, you're growing your practice, right? I was doing it at the same time I am raising my children, but I think acknowledging, right? As I said, like, this season's like acknowledging that you have to protect yourself and that there are times when the business needs you and there are times when home life, whatever that looks like, needs you, right? So if you don't, you wake up one day and you are burned out and it is too late, right? So having a therapist, having a consultant, having a life coach is something I added this year, a life coach, because I'm trying to not be burned out. And I think one of the things, and I'm going to speak for everyone, but I get a sense that like what we didn't want was to be burned out by a hospital system and be burned out by, you know, a 10-minute patient care, right, experience that is so subpar and you feel so personally about it, right? The burnout looks different, I think, when you're an entrepreneur in a way, right? Because you're passionate, like I said before, it's like, it's all the time because you're growing something and it's yours and you want to change things. But you do have to protect yourself from that too. You have to put some barriers up.
I think that is exactly true. That is, you know, for having left academic medicine and done DPC, that was the reason, right? You can't be on that, you know, like just constantly all of the time. And that is what happens to a lot of physicians is they just can't anymore. And so, and then eventually they may just leave medicine altogether, which I, you know, it's such a shame that you've done all this, you dedicated your life to this field and you just can't anymore. And it's getting harder and harder and harder. And so, so then, you know, so I made this choice to leave and practice in this way. And so now it's a different sort of, you know, responsibility. And now all these patients are coming directly on me and I know them all so well. And so I feel, you know, there's always this need to show up for them all of the time. But we do have to protect ourselves. We do have to put some sort of barriers in place. And amazingly, families respect that, right? They know who I am. They know that I'm a mom. They know that I'm a wife. They know all of those things. And so I can put up those barriers even when it's hard, but really important to do so.
I probably have a lot of thoughts on this, so cut me off if I'm going too far. I think that burnout comes from the moral injury that Keili referenced earlier. Everybody who's here at this table and is a medical or a healthcare professional is doing it because they are probably tenacious and intelligent and thrive on hard work. And it's important to know that burnout does not come from working hard. Like, you're here and you've done this training because you thrive on that and you want to find meaning in doing something that's hard and working hard and doing it well and delivering. Burnout doesn't come from that. Burnout comes from when you don't have the toolkit to do what you know is the right thing and that doesn't change. So I think it's important to recognize when you're entering an environment in which there are those problems and to not take a victim mentality to it. If you are a victim and say, I am just sort of here and existing, and these are the challenges that are there, life becomes really hard and can get dark. So a good book for this is The Obstacle is a Way, or, you know, Marcus Aurelius' Meditations, if you want the original version of it. And just really taking those Stoicism principles of like, these are the challenges with which I'm faced. What are the paths forward to solve them? And really trying to empower yourself to fix those problems. And if you find yourself, like many of the people here have either seen or worked in an environment in which those are not solvable problems, then your solution to solve them is to start your own thing. And that is not failure, that is success. So I think that's important. And then part of it is also just figuring out like what your priorities are and not getting out of balance in this. What's the book I gives everybody to read? I can't remember now. It's the white with the black cover. It's my mother. Essentialism, yeah. So Essentialism is a great book. Like, you gotta, if you say, you can never say yes to everything. So you have to figure out what you say no to. And by saying no to things, that allows you to say yes at a higher level to other stuff. So you have to figure out what those priorities are and do that well. Those are big points.
Justin, that's so funny. Stoicism has been like my 2025 journey.
Yep.
So you're referencing Marcus Aurelius is great. I've said like Stoicism, it's in like, you know, it's an ancient problem, right? The issues that we face, and we're in a modern world, and it's like so applicable.
Sure.
So I think that's true to what we've all been talking about too. Is like, you know, you're very, you know, we're very like specific about how we proceed and how we like conduct, right? Like make choices. And so I think that's helpful in terms of inhibiting some burnout, right? Yeah. So it's interesting, it's funny.
Is there another question on that, or Peggy?
No, I was gonna ask a question, but
Okay.
you're the student,
Yeah.
so you're more important.
First off, I'm so blessed to meet you. It's a great opportunity. Thank you all for coming today. I said earlier, my name is Keili. I'm a first year finance and business management, concentration of innovation and entrepreneurship. And just to give you a little bit of a backstory, recently just read this book, excuse me, I pronounced the name wrong, by Gia Zhang called Rejection. And he had this entrepreneurialistic avenue and aspired to be an entrepreneur his entire life. Came up with ideas in his dorm room one day, and he had this uncle that he held to such high regard, sent him the idea, and the uncle rejected him. Told him it's not an idea that he should pursue, and the idea was putting wheels on shoes, and because he wanted to ice skate everywhere, or rollerblade everywhere. And then come to find out 4 years later, Tim Holland came up with the idea of Heelys, and it's just like was distraught. So I tried to spend a day, or an hour a day, just being creative, sitting with my thoughts, and come up with some really cool things. And I guess I'm a business major, and I know I'm going to work with a lot of healthcare specialists, but some of the ideas I come up with, I guess, struggle with pursuing these ideas because I don't have a computer science major or healthcare major, dentistry, or whatever. So I guess my question to you guys is, did you guys ever come up to that same issue? I know you said that you have accounts receivables, actually the business side of things. But yeah, I guess did you guys ever get down? Ever, I'm sorry, I'm not going on a tangent here.
That's a good question.
Yeah, that makes sense.
To quote Anna Goldberg, that is a fantastic question.
You've been waiting the whole hour.
Yes, I have.
I
No,
know.
we already said in the beginning, we had a good question.
So, but in all sincerity, yes, this happens. And I think if I could go back and tell my younger self or past self, or former self, that one of the things that I think I've learned in my 40s that I maybe struggled with in my 30s is that you shouldn't do it all alone. And the team that you build around you really matters. And so for me, it's become, if this is not something that I am an expert in, then we need to find somebody who is. And that's how you're going to grow and build and find something like you need a team. And that is not weakness. That is doing it right. And it matters so much. Like, Keili and I we're very different people, and those things work very well for the components of the business that we do. But neither of us are really like operational people. Keili's like the humanistic person. Here's like the CMO type responsibilities, so like teaching the doctors how to build core processes that allow the model to scale and be replicable and provide the same quality level of service. Sort of like the pie in the sky visionary guy who has like some financial knowledge on running all that stuff. And then like Drew is an operator, and like that's what he does. So like he is our integrator and makes all that stuff happen. And like without the three of us as a triad doing those separate roles, like this business would not work well. And if you try to fill one of those that you're just not good at, it would probably fail. So, finding your team who can help you support those things, if you have an idea that you really believe in, that's good. And the other thing that I think is important for you in this stage where you're being very disciplined about doing it too is not to get discouraged if you have one idea and it's fantastic and then you find out that somebody else owns the patent on it. Who cares? If you have one idea, you can have other subsequent ideas, and it's just going to be time until like this soup lines up the right way where all of the ingredients are in the pot at the same time and it turns into success.
I'm going to echo Justin again here, but I think creating an idea space, so to speak, is like so important, especially when you're really interested in a subject and you can figure out like ideas to make that better. That's awesome. So creating that space is keep that up. I think, you know, beyond just trying to take an idea and make something of it, right? The whole idea of like colleagues, friends, people, you collect people to be in your network to make you a better provider, a better entrepreneur, a better business person. Like that is so important. So I can't imagine not having like a large network of people around me that I can, you know, discuss an idea with or create something alongside. So yeah, you can't do it alone and you shouldn't. And I think most of the time when you collaborate, it's, you know, and it goes well, right? When you collaborate and it goes well, like it is such a more meaningful experience. So, yeah.
What stands out to me about your story is in that book with the person who went to his uncle. And I think, you know, it is rare that there is one person whose opinion if I have an idea, whose opinion's gonna stop me. So even, you know, the people that are most important to me, if I feel passionate about something and I hit a roadblock from someone who's important, I'm gonna talk to at least 3 other people before I decide that I'm gonna give that up. And so that was the thing that when I listened to the story, I would want somebody who's younger to come away with. Because I think when you're young and you're impressionable and you look up to someone, you think, well, they said no or they said yes. I mean, who knows? But you've got to learn, you've got to find your own truth, and your own truth is going to be usually not just one person's opinion. So.
Thank you. Do we have time for one more? Or?
I don't think so. We are coming up on time. Michael, I don't know if you want to say any last.
Yeah, let me just wrap it. It was a fast hour. It was fun.
I know.
Because I know this group so well. It's wonderful actually to have you guys all together. So with that, Christopher, thank you for moderating. You did a great job. Really appreciate it. Justin, Keili, Margaret, and Lucene, thank you guys for doing this again. I'm sorry I'm not able to be there. Thanks for a number of folks who joined online. I think given the varied professions that you have that come into this topic of starting private practice, I know we had some really good interest, and I hope there'll be some follow-up. I know there's a number of dental medicine students on here, in particular Margaret. I know we've had some emails about ways to do more with the School of Dental Medicine, and hoping to do that across schools. And this pretty much does it for our programming for the year. We're kind of heading into the end of the semester and graduation and final exams, and we'll be working on with Britton on thinking of new programs, and actually look forward, Justin, Keili, Margaret, and Lucene, to brainstorm with you guys about other ways that we can do something like this. So thank you guys for joining today. Have a great weekend. And I'm sorry I'm not with you to grab a quick coffee afterwards. I think for those that are there, there's a little bit of snacks and coffee for you guys. And for everybody else, look forward to seeing you guys soon.
Thank
Bye,
you.
Michael.
Thanks,
Thank you.
Michael.
Thanks, everybody.
Thank you.